Hi guys, my name is Rebecca Konecek and this is Conversations with the Doula. I'm going to give this a minute or two and then we'll get started once some people join us. I'm really excited about today's video. If you're just now joining us, I'm going to give it just another minute and then we will get started. Today we're going to be talking about how to make padsicles and other postpartum care things, so it should be pretty fun. We'll see how it goes. I'm going to use kind of like the next 30 seconds or so to just kind of go over. So this is Conversations with the Doula. I work as a community-based doula. If you haven't seen my first video, I explain sort of who I am and what I do. I work for Shawnee Health and our Healthy Families Illinois program as a Doula and Enrollment Supervisor for our Healthy Families Home Visiting program. And if you aren't familiar, it's non-medical support before, during, and after labor. So I think I'm gonna go ahead and get started. So again, my name is Rebecca Konecek. This is Conversations with the Doula, and today we're gonna make padsicles and talk a little bit about postpartum care. I think this is really important because this is sort of a topic that people don't talk about a whole lot. I don't know, like, kind of why that is, but people always tend to tell you their story about labor and delivery, good or bad, but no one really tells you about after what to expect and things to sort of prepare for and do for yourself during pregnancy so that your postpartum period goes a little bit easier. So that's where padsicles come in. So if you haven't ever heard of a padsicle, it's essentially a pad that you put in the freezer and it's frozen, so it acts as both a pad still absorbing blood and discharge and things like that after you have a baby, but also as like an ice pack. So this is kind of a fun thing to do in the kind of like later days of pregnancy. If you're like me, I'm 33 weeks right now, so those last like 6 or 7 weeks tend to really drag for people. So this is kind of something to keep you distracted, kind of a little activity to do. You know, maybe you and your mom or you and your sister can do it together, something to kind of connect you with someone else and keep your mind busy at least one day out of all the days you have left. Those last like 6 weeks seriously feel longer than the whole 9 months combined, so this is kind of a fun thing to do. So for the padsicles, the supplies that you need, aloe vera gel. You can get this anywhere, you know, it's just aloe vera, just like what you'd get for like a sunburn or anything else. You can get some more organic kinds or just kind of like the classic. I just got this from Walmart. This one actually has lidocaine in it. I hope that that's facing the right way for you guys. It's backwards for me, but so, you know, it's going to kind of help give you a little bit of numbing feeling too. So that's always helpful for after you have a baby. Witch hazel. This is Thayer's brand. This was kind of hard to find. You can find witch hazel, hope you guys can see that, at the store. But this is alcohol-free witch hazel. It's very important to get the alcohol-free because you do not want to be putting alcohol in anything that is, you know, an open cut or anything like that. So witch hazel, I found it in the facial toner section. So kind of like where like your face masks or like makeup remover wipes, things like that. I found it at Walgreens, but I'm pretty sure you could find it at most places. This is unscented and alcohol-free. It actually says aloe vera formula, so it's great because you're combining witch hazel and aloe vera anyways. They did have a lavender scented one too, and so if you wanted to have a lavender scent, you could do that. I've watched like a million different YouTube videos over the years, and I have 2 kids, so this is my 3rd pregnancy, and a lot of them talk about like adding essential oils to your padsicle to kind of have a nice little scent. I just always haven't done that, but like a lot of them recommend using lavender, so that's an option too. You of course need a pad. Guys, like, don't be cute about this. Get like biggest, longest pads you can find. Like, we're talking Maxi Pads. Don't try and be discreet. Like, get the biggest ones. You're gonna need them. Like, full discretion. There were days where I used 2 pads, like one in the front, one in the back, because you have a lot of stuff happening, and so like definitely get the biggest ones possible. I have a tablespoon. I'm just using like a regular spoon from my kitchen because I think it'll be easier to dump it and like smear it around. I also have a little thing of wax paper. I just cut it into like little strips. That's just because when you fold it back up, you want to kind of keep it so that it won't stick together, because you're going to fold them back up and put them in your freezer. I also would say it's probably a good idea to have a gallon Ziplock size bag to just put them all into and then put them in your freezer all together so that they're all in one spot. You don't necessarily have to have those 2 things. So I'm going to kind of like turn this so you guys can hopefully see, and I'm going to just, so open up your pad. This one has wings. You don't have to have them with wings, but again, you bleed a lot. There's a lot going on. So it's nice. Some extra coverage. I'd recommend doing the aloe vera first because it's thicker, so I just think that it spreads better. You need 1 tablespoon of aloe, and you're just gonna squirt it into your spoon, put it on the Maxi Pad, kind of smear it all around. You put the little strip back on there and then fold your pad back up, and then put it in your bag, and then you can stick it in your freezer, and you could probably fit like 6 or 8 in here. Sorry guys, my connection just got kind of funny, so I hope that I'm back on. So you put them back in your bag, and you can stick them in your freezer, and then they are ready for you for whenever it's the big day. There we go. So you can make as many as you want of these. I would say like you'll definitely need them for the first few days. So kind of think about how many pads you think you'll go through. You know, I'd say probably like 5 a day. I'm kind of totally guessing on that. So make as many as you think you need. I don't think you can really overdo it. This is also kind of like a good idea for anyone who has anyone in their life that's going to be having a baby and they want to do something nice for someone. I always think it's nice to like do something for people rather than buy them things, especially like baby clothes and stuff. So make some padsicles for them and bring them over, or you know, make them some dinners and freezer meals and stick them in the freezer so they have that stuff later. I think that's super helpful. So some tips with using these pads. So they are frozen, so when you take them out of the freezer and you put it on, it's gonna thaw out and you're gonna have some like leaky, drippy water, you know, coming out. So as it thaws out, so you're gonna want to like sit on a towel, or you know, do it in a time frame where you can kind of be wearing it and actively sitting on something that's gonna be absorbing. A lot of people will wear these with like disposable underwear. The hospital will give you like mesh underwear that you can use and just throw away. So you can use them with that, or you know, like people talk about like Depends and stuff like that, like adult diaper type things. I think like Always has like a brand of disposable underwear that you can get, and you could stick it in there, and those are kind of like designed to hold the pad, so it usually stays in there really good. So so just know that it's gonna leak a little bit as you wear it. And then also some people have just like sensitive skin. So if you're not comfortable with doing witch hazel or aloe, like these are pretty like, you know, natural ingredients that people typically don't have any sort of reaction to. But if you wanted to do, if you're worried about yourself having like some sort of reaction with your skin, then you could maybe just do a couple tablespoons of water and wrap it up and put it in the freezer and have it just basically be an ice pack that still acts as a pad. So that's an option too. The other thing is that when you take it out of the freezer, you want to kind of let it thaw for a couple minutes before you put it on. So like maybe 5 or 10 minutes. I literally think about like an actual popsicle. When you first get it out, it's really hard, really frozen, really intense. And you kind of like just move it around your hands for a couple minutes and it settles down and gets a little bit easier to move around. And so that might be a little bit more easy. Otherwise it can kind of like stick to your skin, and you obviously do not want that. So those are kind of my tips. I mentioned that the hospital gives you the mesh underwear to come home with. I wish I had a pair to show you guys, but they're really, really stretchy. They're like one size fits all. They're kind of like little briefs. So they kind of go up over your belly, which is nice, and like they're just really comfortable. The only thing I'll say is that like the mesh material, like a pad doesn't stick that well to the underwear. So that's kind of one of the reasons why I would wear like 2 sometimes, just to make sure I had full coverage. So that's just something to be aware of and think about. But I mean, they're free disposable underwear, so take as many as you can from the hospital for sure. Some other free hospital items that you can come home with. Peri bottle, this is what it looks like. It's literally just a clear plastic bottle. You put like warm water into it. When you squeeze it, water sprays out the top, so you can just hold it underneath and spray. This is really comforting, especially if you're going to the bathroom and you're peeing and you have any cuts, or even if you don't have stitches, like sometimes you just have little cuts and things, like little splits in your skin. You'll hear like doctors or midwives call them skid marks, so they don't repair with stitches, but it still is an open cut. So when you pee, it burns. So you want to kind of spray some warm water as you're peeing to kind of help dilute it and just kind of clean everything out after you go to the bathroom. You're going to want everything you can get that's going to just make you feel nice and refreshed and clean. So these are really nice. Hospital gives them to you. I've got like 3. You can buy Peri bottles too at the store, different brands and stuff, but I mean, again, they're free. It's a pretty simple concept, so I'm not really sure that it'd be any different. These are Tux pads, if you guys can see that. So it's in like a circular container with a lid. They're little circular pads that have witch hazel on them. They're called like medicated cooling pads. These are really good for hemorrhoids. It's kind of what they're known for being used for. So some people use these just during pregnancy anyways, and then some people look to use them postpartum. They feel really good. I don't really know why they're in a circle. I wish that they were just in like a strip so you could put it on your pad and be done, but people usually put like 2 or 3 of these on a pad and line it up and then put it on. But they're just really refreshing and, like I said, useful for like hemorrhoids. The hospital has flushable wipes. You won't really want to be using toilet paper, so flushable wipes are really nice to have and use. You can bring a package of those home. I would not recommend flushing them. They're really big. They're like 3 times the size of a baby wipe. And we just had some plumbing issues, and the reason why was because we've been flushing flushable wipes that we use with our toddlers. So don't flush them if you want to hear advice from me, because it doesn't turn out well. Throw them in your trash can, throw them in your diaper genie or whatever else. The other thing that they have at the hospital are these like, they're like ice packs that are pads. So kind of like padsicles, but it's like a legit ice pack that you squeeze and you shake up and it turns really cold. And then it's a pad that you can stick on. They work really well as far as getting cold really nicely, but they don't really absorb super well. So that's kind of a little bit discouraging, but they are really nice and you can take some of those home. I use them as a doula a lot as ice packs on people's backs and stuff when they're in labor. So those are kind of something to think about. You'll get sent home with pads as well. That's something that the hospital has there for you, so don't feel like you have to pack those and bring those. So you'll get sent home with some pads, but you want to have some at home as well. So all of these things are useful for anyone. Like, it doesn't matter if you have tearing or stitches or you don't. You're gonna be sore no matter what situation happens. Like, some people are really sore, some people aren't that bad, but everyone has some amount of discomfort. Like, you just had a baby. So be gentle on yourself and have some of these things ready to go. Don't try and tough it out. Like, you know, a lot of people take like ibuprofen or Tylenol to help with different stuff, inflammation. Ice is great for any sort of swelling or inflammation that you might have. So these are things that like anyone's going to use no matter what situation. Maybe not with a C-section as much, but you're still going to have some discharge and some bleeding. So you're still going to need pads and stuff, and you're still probably going to want to use like a peri bottle. So that's just kind of what I want to throw in there. It's just like everyone should kind of plan on having these things, because it's going to be something you're going to want to keep. You're going to want to have on hand. You don't want to be trying to like go to the store with your newborn baby in the middle of a pandemic after everything, whenever you're hurting and sore. So yeah. So I'm interested to see if anyone has anything that they sort of want to learn about in the coming weeks, any topics, anything that they want to discuss or hear about. If people have any other products that they think were like huge game changers for them in the postpartum window, I'd love to hear about it. There's always different things out there. Like I said, I've watched a ton of different videos and stuff each pregnancy, just to kind of see if there's anything to think about getting, anything new to make it a little bit easier. It's a tough time physically and emotionally, so anything you can do now to prepare is always a good idea. So please let us know if there's anything you guys want to hear in the upcoming weeks. I think I forgot to mention in my first video that I am a Certified Lactation Counselor, CLC. So if anyone has any breastfeeding questions, and there's a lot of stuff with like nipple discomfort and stuff, that is really common, and so we could talk a little bit about that. I could talk for days about all the stuff with postpartum. So that's definitely something. And Haley's asking if I will post the ingredients and steps to make the padsicles. That's definitely something that we'll do whenever this video will upload, and you'll be able to watch it again, and we'll have the ingredients posted and step-by-step instructions. So tune in next week on Wednesday at 4 o'clock, and I will see you guys then. Thank you.